Right, this is not a topic we talk a lot about, but it affects millions. It is dry mouth, the constant thirst, cracking lips, bad breath. You may think it's just annoying, but it's much more than that and can cost you time and a ton of money. Busy mom and wife Shireen Pomerani from Santa Monica takes time for her family, herself, stays healthy and active. But 10 years ago, her normally good visits with her dentist weren't so good anymore.
I was getting more and more cavities.
She'd get them fixed. They kept coming back.
I didn't know what was the reason because I was taking care of my teeth.
The cavity were getting so deep that the teeth were breaking off. None of it made any sense. Until one day, I started to ask her, what medications are you on?
Turns out after a hysterectomy, she was put on medication for hormones, in addition to cholesterol and allergy meds she already took. All of them on this huge list of medications we found that can cause dry mouth, something that goes hand in hand with tooth decay.
And that is when I put everything together, that the dry mouth was causing an overgrowth of a very aggressive type of bacteria in the mouth.
Her dentist, Kurish Madahi, says most people have no clue dry mouth is more than irritating. So they say nothing, and the problems get worse.
Thousands of dollars of doing some work, redoing it.
The list of medications causing dry mouth is easy to find right on the computer. Hundreds of medications for common ailments and conditions. From
simple pain pills to allergy medicines, antihistamines, to diabetic medication, to hypertension, to anti-anxiety medication, antidepressants, all sorts of medications are not causing dry mouth.
But the doctor says there are simple solutions to help. Avoid caffeine and alcohol, sip water, chew sugarless gum, sleep with a humidifier. Also, use a wash for dry mouth. When the doctor couldn't find one that was organic, chemical-free, and would not interfere with medications, he made his own.
I decided to make a non-alcoholic mouthwash that had dead sea salt in it, aloe vera juice, xylitol, which also reduces the cavities in the mouth, and also essential oils.
Shireen's been using the mouthwash and home tips for several months now. And her last checkup, no new cavities.
I've seen a miracle.
Now she can spend less time in the dental chair and more time with the people she loves. Well, isn't that most important? Okay, rinsing with sea salt and water, as you saw, can also help. If over-the-counter tricks aren't working, see your dentist or doctor. We have more info on cbsla.com. And if you're going to make it yourself, it's half a teaspoon of sea salt, mix it in some water, stir it around, and then swish it for about 60 seconds. It's not pretty, but it does work.
But it works. It's the job done.
Yeah.
Thank you very much.